During a surprise visit to a busy hospital ward, President Trump is suddenly confronted by an elderly woman named Letitia Harwood, who stands trembling with tears in her eyes and a crumpled letter in hand. The letter reveals that her grandson has been denied surgery due to sudden healthcare funding cuts, leaving her family desperate and without options. As the room grows quiet and all eyes focus on the moment, Letitia steps forward and asks, "Mr. President, what are you doing about this?" Trump, surrounded by aides and hospital staff, listens as she explains that the new policy ended her grandson's coverage. Trying to stay composed, Trump responds that the cuts are about efficiency, about getting the money to where it's needed most. But Letitia doesn't back down, her voice rising as she says, "Efficiency? My grandson's life isn't efficient to lose." A nearby nurse, Dr. Selma Rohr, supports her, explaining that the hospital has seen a 20% drop in funded cases since the policy changes, and real families are suffering. Trump raises his hand and says, "Hold on, I get it," then adds that he inherited a broken system, a total disaster. The tension continues to grow as the room waits to see whether the president will walk away or take action. Trump frowned and said, "The old system wasted billions, just bloated with bureaucracy. We're streamlining it, fixing things. Your hospital is part of that fix." But Letitia, wiping her tears, snapped back, "Streamlining? My grandson's in pain, and your fix left him out. I've paid taxes my whole life, and now this. Explain that." The staff murmured, and a few patients leaned in, listening closely. Trump pointed to the letter in her hand. "Show me that. Let's see. I'm not here to ignore people. I'm here to make America great again, and that includes health care." Letitia handed over the letter, and Trump quickly scanned it, his brow furrowing. It says the treatment was denied due to new allocation rules. Who made that call? Hospital management. Dr. Rohr stepped in, explaining, "The hospital followed your policy guidelines. We're now told to prioritize only emergency cases. Surgeries like her grandson's were pushed back." Trump turned to her sharply. "Deferred? That's not what I meant. I said prioritize smart, not cut people out. Who's running this place?" Nervously, the hospital administrator, Thane Culver, stepped forward. "Mr. President, we followed federal directives. The budget was cut, so we had to reallocate." Trump's voice rose. "Reallocate? That's just a fancy way of saying you dumped families like Letitia's. That's not what I stand for. My administration's about helping people, not hurting them. Show me the real numbers." Hesitating, Culver pulled out a tablet and projected a chart. "Here, sir. Funding dropped 15% this quarter. We had to cut non-urgent cases." Trump stared at the data, clearly not liking what he saw. Trump pointed at the screen. 15%? That's a big drop. But look here. Admin costs still take up 30% of your budget. That's where the waste is. We should be cutting fat, not care. Letitia spoke up, her voice firm. "Fat or not, my grandson isn't just a number. He's a child who needs help. Now, can you actually fix this, or are you just here for photos?" The room grew tense, with staff nodding and whispering in quiet agreement. Trump leaned toward her and said, "Letitia, I'm not here for photos, believe me. I came to fix things, but this hospital has to do better." "Fane, why do you have more admin staff than doctors?" Fane hesitated, then said, "We had to hire more people to handle the new reporting rules from your policy." Trump shook his head. "Reporting? That's backwards. I want doctors, not more paper pushers. Letitia's right. This isn't working. Dr. Rohr, do you agree?" She nodded. "Yes, Mr. President. We need more care, fewer forms. The cuts hit us hard and our patients are suffering." Trump paced briefly, then stopped. "Okay, so the policy may be right, but the way it's being carried out is a disaster." Letitia explained, "Why is your grandson's surgery considered elective?" Letitia steadied herself. "It's a heart procedure. Not an emergency yet, they say. But if we wait too long, it could be. His doctor says it's urgent soon." Trump turned to Dr. Rohr. "Is that true?" She nodded again. "Yes, sir. It's borderline. Without funding, there's a serious risk." Trump turned to Thane, his tone sharp. Borderline? That's not acceptable. Why wasn't this flagged earlier? Thane shifted uncomfortably. The system prioritizes immediate risk, Mr. President. We're too understaffed to review every case in depth. We're too understaffed to review every case, Thane admitted. Trump frowned. Understaffed because of admin overload. Now, I get it. Letitia, this isn't your fault. It's theirs. Letitia stepped forward, voice trembling but firm. So what now? My family's out of options. Trump paused, then pulled out his phone and dialed. Get me the health secretary now. We've got a problem. He waited a moment, then spoke clearly. Yeah, it's me. The hospital's a mess. The cuts are hurting patients, not fixing waste. Change it. Start with Letitia Harwood's grandson. Full coverage today. And audit this hospital / the admin fat. He hung up and turned back to Letitia. Done, your grandson's covered all expenses. We'll handle the rest. Letitia's eyes widened as tears spilled down her cheeks. Thank you. Mr. President, thank you so much. Soft applause rippled through the staff while Thane stood frozen in shock. Trump nodded, adjusting his coat. That's what I do. Help people. This hospital's got work ahead, but we'll fix it. Take care, Letitia. With that, he turned and walked out of the ward, his team close behind, leaving Letitia smiling through tears as the room slowly settled. If this moment moved you, take a second to reflect and share it with someone who might need hope today. Don't forget to subscribe and leave your thoughts in the comments below.